Okay, so we got that fixed. All right, so welcome everyone. Thanks for joining us today. I think we have a great topic today, and I'm looking forward to having a discussion with Vince about some things that are really relative to our current climate. Most of us know each other. Some of you may not know us. My name is Ed Probst. I'm the founding partner of the Vanguard agency. We're an employee benefits consulting firm currently located in Melville. We work with employers, helping them provide benefits for their employees and helping them achieve employer of choice status. So a couple of things I want to talk about before we get started. Some housekeeping. If you have a question, we're going to do this a little bit different today. I'm excited about this format. We are going to have a Q&A with Vince. And we're going to cover a myriad of topics, but we're going to encourage you throughout our talk to type your questions in the chat. If we stay around the same amount of participants that we have right now, that we can, and there's no feedback, we can keep everybody off mute, and we can even ask some questions along the way verbally. So keep that in mind. Also, we are still always trying to improve our content. And so if you have any suggestions of topics that you'd like to hear about, please type that in the chat. We'll make sure that we work to get speakers and topics that are relevant to that as well. And on that note, our next event is going to be on September 30th. And we will be discussing Medicare 101. So in advance of the upcoming open enrollment season, we thought it would be timely to have a discussion on Medicare. So on September 30th, we'll be doing a Medicare presentation. And then on October 14th, we will be having a discussion with Danielle Escalante from Northwell Health. And we're going to be discussing employer wellness strategies and the impact that has, as well as several other things. So that's our upcoming events. Wanted to just, talk briefly about our topic today. So as we all know, and many of you are business owners or deal with business owners on a regular basis. A lot of you are employers, some of you with nonprofits. In our current landscape, there are certainly many challenges that employers are facing. Whether it be the impact of COVID-19, planning for an uncertain future is definitely on the minds of a lot of employers right now, dealing with their business and trying to keep up with the challenges they're facing right now from a perspective, just keeping their business open, but then how employee benefits relate to that, whether they've had furloughed employees or they've had to terminate employees. Or how they're keeping up with recruiting in times like this, which benefit plays a big part of. So our go-to person on this, I thought was a no-brainer, was to ask Vince Ashton from HealthPass. And just to give you a little background on Vince, Vince has been the CEO of HealthPass for over 20 years now. We have a long relationship with Vince and his team over at HealthPass. They do an incredible job. We have many of our clients with the HealthPass private exchange, and they have just about 20,000 employees that they represent. They also represent over 2,000 businesses. So Vince really has his pulse on the small business owner, the small nonprofits, up to 100 employees, which, in either case, even though it's categorized as a small business, a business with 50 or 75 employees has many hurdles they have to jump over to meet compliance needs. And certainly now, when providing benefits, it's more difficult than ever. So we knew that Vince would be a great person to have. And like I said, we have a 20-year relationship with Vince. His organization is top notch, and they do a great job. So welcome, Vince. Thank you for being our speaker and panelist today. I'll just turn it over to you for a moment if there's any opening comments you'd like to make before we get started, and then we'll just jump into some content.
Yeah, just really quickly, thank you for putting this together. It's good to be able to talk to you guys directly. I don't get this opportunity that often, and I haven't done it in this forum before, so it's going to be nice to have this interaction and exchange. I'll let you know what I can. I don't actually work directly at the insurers, but I do have an insight that a lot of people don't get because of that, because of my relationship with them. So when it comes to rates and setting and premiums and all that kind of stuff, I kind of get some of the inside info on what's going on. And I'll share with you what I can as far as that's concerned and everything else, and try to leave you with a few ideas to take away that hopefully will be something that, gets you thinking about how to do things in the future.
Great. So for those of you that don't know what HealthPass is, it's a private exchange model, which means that Vince has relationships with right now 4 different health insurance carriers, also relationships with 3 different dental and vision providers, as well as relationships with carriers that provide long-term disability and life insurance. Even pet insurance is in his exchange. And we like to use it because it gives the ability for a small employer to be able to become an employer of choice per se. It gives them the ability to expand their bandwidth with the kind of benefits they're offering and keep it all into one bundle. And Vince will talk a little bit about the technology they provide as well, which is more and more important these days. So what I want to start off with, just Vince, what are you seeing right now? Give us some insight about what you're seeing is the biggest challenges that small businesses, small nonprofits are facing right now, in general, and when it comes to providing benefits to their employees.
Yeah, it is in some ways a lot of the same when it comes directly to the benefits. It's just on a different scale. The insurance premiums are continuing to rise year over year. They're not anything we would be calling affordable at this time. And at the end of the day, right now, with the economic pressures of this pandemic and the disaster, it's making that all the more difficult for employers to continue to do what they want to do and offer the best that they can when it comes to their the benefits plans that they want to put out there. So, for me, it's staying the course is the biggest challenge. We're a small business ourselves. We're grappling with the same issues that a lot of the other people on this call are dealing with. And it's, how do you manage this kind of remote challenges? How do you keep everybody engaged? All of those things are the same things that we're dealing with. And then when it comes to the health insurance, it's how do you really keep people interacting with it? How do you keep them abreast of what's going on? And I think that, that's a separate challenge. Right now, I wouldn't say it's your number one challenge, right? Most people's number one challenge is how are we afloat in this environment and how's it all working? But if you've gotten past that, it's kind of how does that now affect your day-to-day or year-to-year? And health insurance, obviously, it's not something that you guys want to deal with on a day-to-day basis. I know, hopefully it's something you get to put into place and then leave it alone and come back a year later when it renews and everything's great and you have no increase and you say, perfect, but that doesn't really happen that way. And I think it's trying to figure out how to navigate between those parts, continue to do the best that you can to keep your employees engaged, let them know that they can use their healthcare, all of those things. And especially now, I think that there's a challenge in keeping up with all the changes, right? So the education, the communication, if you're lucky, you're working with people like Ed who are out there on the forefront, keeping people abreast of all the different changes. Because frankly, we aggregate, we don't work with as many carriers in total as Ed and his group does. But we have enough rules to make it challenging just to keep it straight in what's going on with our carriers, much less the entire marketplace. So I think it's really important to have somebody there at your side that you can talk to who can help out. So beyond that, Ed, I don't know if...
Well, I'd be interested. So what are you hearing as far as from a premium increase? Give us your insight on what you think is how COVID-19 is going to impact health insurance responses to premium rates. What's it look like now? What do you think it's going to look like in the future?
Yeah, so premiums are a little bit tricky. The timing of them are a little different than what people realize sometimes. So basically with the way that New York is set up and the timing, there's going to be the impact of COVID on rates, not in 2021, but it'll be in the 2022 rates, because it's going to be looking the data in the data that's happening now in 2020 was not in place for when rates needed to be set for 2021, which the initial had to be back in early May. So at that point, there was no way to really do anything to account for COVID claims, any of the things that would happen during that period of time. So rates were set. That was it for 2021. They were reviewed by the state. They've been put back together. We're waiting for the finality of those to come out, which come out in the next couple of weeks, and everybody will kind of see where things stand. So for 2020, though, what happens is, even though the rates are set ahead of time, the experience during the year is something important as well. As you guys may or may not know, in New York, we have some standards that have to be met. The Department of Financial Service does prior rate approval, which is one thing, and we'll talk a little bit more about that at some point. But the other thing is they require a certain percentage of the monies that come in via premiums to go out and to pay claims. And in small group, that's 82%. In large group, that's 85%. That's a statutory requirement. If they do not meet that, they are required to basically rebate premium back to people. So if you guys did notice, some of you I know probably were enrolled with Oxford United this year. They did that. They gave a premium rebate back to people this year because ahead of time they could see what was happening was because of COVID, although a COVID claim can be very expensive, and there were several of them for a lot of insurers, all of the, I don't want to call them unnecessaries, but the non-emergent procedures that need to be done, all the elective surgeries, they all got put off. And so their assumptions at the beginning of the year as to how much money they were going to have to spend on patients and on claims started to bottom out because they weren't paying for elective procedures because they weren't happening, and they weren't paying for these other procedures that were non-life threatening and non-emergent that could be put off. Time being, during this period of time, it's really a situation where they've taken in too much money for what they're paying out. Now, the flip side of this is that those non-emergent procedures don't go away. So although they haven't paid them out to date, they will wind up paying them out. And so you've got basically a backlog of services that could be building up, which when that kind of dam breaks, people are feeling more comfortable going back to the doctor, the hospital, and having all of these services more so than they are now. You could very well see a large spike in the claims, which would then translate to a larger spike in what the costs are for the insurance. But again, we're talking about trailing numbers, right? So the stuff that happens maybe 6 months from now when that logjam breaks isn't going to be reflected until probably at that point 2023 rates. So it gets pushed out further and further based on all of this stuff.
Yeah, and I want to just emphasize to that point that what we're discussing here is for small businesses in New York, right? So we're talking about groups that are under 100 employees that are regulated by the state, that the state sets the rates, and these rebating laws do apply to those size groups. But you know, I want to touch on something that I think is important and get what you're seeing, Vince. You know, one thing that we know that with the impact of COVID-19 definitely hurt businesses, especially in the New York City, which HealthPass is a New York City business, and there was a lot of turnover. You know, with the advent of the PPP program and various other stimulus packages, you know, we didn't see as great of a true turnover as we thought we would, right? So we didn't see on our end any mass layoffs or terminations. There were certainly a dramatic amount of furloughs, but employers seem to keep their employees, for the most part, on benefits during that time period. I'd be interested to hear, you know, what you saw and if you saw a very similar type of pattern.
So, yeah, so March, let's just kind of, I'll give you my timeline and where the day that my heart skipped a beat, just because everything went back to okay. So, but March 15th is when we vacated our offices. We were looking and watching and seeing what everybody else was doing and how it was impacting people, and around the time that a lot of people were going out. And we started getting concerned and saying, what's going to go on? How many of these businesses are going to just shutter? How many are not going to be able to continue to go on? What are they going to be doing? And, you know, nothing had happened. It was calm, quiet, everything was fine. And then I looked at my report on March 31st, the last day of the month, And we lost over 1% of our membership on that day, in one day. That doesn't happen. That's a large amount of membership. And it was all done on people who were being let go or put onto furlough, basically, that they didn't way necessarily for our thing. But basically at the end of the day, these weren't groups that were going out of business. These were people who were being laid off within the groups. So when that day hit and my heart skipped a beat, because I said, look, if this continues on for, any kind of period of time, this is going to be game changing for us and for everything that's going on. But it wasn't. It was a blip on the radar. It was something that there was, when we went back and we looked and we could see that, that it wasn't groups that were actually terminating. We looked at the leading and the data thereafter, and it did not, that spike wasn't there anymore. And what we really attributed it to was the fact that there was a lot of people who sat on their current situation. Sorry, guys. I just had somebody come in the back, and it just threw me off. But
I think we've all been through that. So
yeah,
no apologies needed. I don't think there's a person on this who hasn't had a child or a pet or a spouse run by during a meeting. So all good.
Yes. So yes. So I'm sorry. I've totally lost my train of thought of where we were. So if we can just, Ed, you want to pose that question again for me? So I'm completely thrown off right now. I'm sorry.
Yeah. So what we were just basically, and I'll lead into my next question. We were talking about what you saw, how you mentioned how you had the 1% loss of your membership on the one day, and what you thought that how that's going to continue or not continue, and
right.
What we're
so
seeing.
It stabilized.
Right.
Yes. Sorry, and thank you, Ed. I'm really sorry about that. So it's
good.
Out. Yes, everything stabilized after that fact. So we did not see the large amount of group terminations, but also the PPP loans came into place at that point. So then it became a question for us, and something that we're still looking at, where we're saying, okay, the overall impact, we've seen, a little bit of attrition amongst the groups. You see that happening. There are definitely some of the smaller businesses that have not been able to make it. The retail shops are having more difficulty than some of the others. But a lot of them were able to make it, kind of bridge the time period with their PPP loans between really March and then making it into April, May, a little bit further. Concerned starting with maybe July, really August, that we'd start seeing more businesses that used up their PPP loan money and have then come to the realization that they're not going to be able to continue on. We haven't seen that happen as of yet, but we are continuing to monitor it because we're in that sensitive spot right now where groups are having a hard time figuring out how to continue forward, especially if it's been difficult for them to adapt their model to kind of this new world. So.
Yeah, absolutely. And, on that note, one of the things that we saw a tremendous amount of was obviously furloughed employees, employers that are chomping at the bit to get back to work and chomping at the bit to get back to what they do. But they had to furlough some employees, and they don't want to lose these employees. I mean, I think that's one of the biggest things that employers are faced with right now, is that they have great employees that they want to retain. So you're seeing that even though during these furlough periods, they're still providing health insurance and still providing benefits to these employees, but that creates some complexities of it in its own. So, I mean, that really, how do you manage that? A lot of the questions we're getting are, am I required to keep my employee on benefits while they're out? If I'm not required, should I do it? Really? And it really comes down to, again, the same things that really steered you towards providing benefits in the first place, is keeping that valuable employee. And that's a real challenge, but it's also going to create some onboarding and offboarding challenges, right? So you have employees that are either furloughed or they're in a terminated status. Did you offer them benefits on the current group plan? Did you terminate them, put them on COBRA? What does that look like? The complexities of COBRA, the complexities of managing COBRA and the compliance issues of it. So, if you could just speak to that for a moment, and what's the best way for employers to manage that whole process and not make it even more burdensome during an already challenging time.
Yeah, no, I mean, look, there's using the experts is going to be important. And again, I'll kind of defer first and foremost to the folks like you, Ed, who are on the forefront in finding the solutions that fit for this kind of stuff, because it is wide and varied what you need to do to be compliant. We try to build that in, at least from my experience on the Health Pass side, we try to kind of build that into the package that we offer people. So doing things like dealing with COBRA administration or state continuation administration when you're dealing with furloughed employees and people who are being laid off, and having to, you know, do the follow-up, try to keep them on the insurance, figure out how all that works. You know, we try to really take that onus off of the employer by doing that COBRA administration on their behalf. In the same way, we try to do that on a day-to-day basis, really, with things like Health Advocate, where we give that benefit to folks where individual employees can go to them and use them as a resource rather than going to their employer to ask questions that they may not want to be asking, and things of that nature. So, you know, it's important to, I think, find the right partners, right? This is more and more, as this industry gets more and more complicated and complex, it's the partners and the partnerships that you know, put together that are really going to be able to take you through and make sure that you have a strong team, because this is not a job for one person trying to take care of the healthcare. And especially for those of you who are in charge of it, you know that it takes, you know, the entire organization to really make this thing work the right way.
Vince, how important do you think technology is in this whole situation? And are you seeing that more employers are looking for technology solutions for managing their benefits, whether that be just benefit administration or all their benefits, like HR tasks and onboarding and document storage and things like that? Are you seeing more of an uptick in that because of COVID-19 and the ability and the fact that there's just more turnover going on, or more transactions going on?
Yeah, there's an obvious uptick in the need, not only to have it now, but I've seen for the insurers that we work with who don't necessarily have solutions right now, they're really putting a fast forward on trying to get these things and expediting their plans for tech solutions. So, technology is going to play a greater role. This is just basically, it's warp speeding the adoption rate on a lot of things, right? There's so many things that should have been done this way already, the interaction, the way that things go. And I think, as I said, right now, telemedicine, right? That's a really easy one to point to and just say, look at how that has come to be and how it's just changed in the last 6 months. Nobody would use telemedicine regularly. Maybe on occasion you would try it, but now it's a way of life basically for a lot of people, and their way of first interaction with the healthcare system. I do think that also you've got other things that when you're looking at, and as a business owner, interfacing with it, you need that technology to help you. So, for example, as Ed was mentioning, when you're onboarding and bringing people on, when you need to bring them on to the health insurance, for us at Health Pass, right, we have an integrated benefits admin system. Basically, it allows you to be able to go in, load in your information for your different employees on the front end. They get sent an email, and each person then goes, and on their time, when they can, either with their spouses or with other interested parties, can sit down and look through and use filtering tools and decision support tools that'll help them find the plan that makes the most sense. Because in our instance, as Ed had mentioned before, we're an exchange. We offer actually 62 different plans for people to choose from. A lot of different plans. You need some help to figure out how to whittle that down. But that technology is going to be even more important too when you're talking about now, how do you get everybody enrolled if you haven't done this before? How do you renew your plan if people want to make changes, or if you want to make a change, right? It's right now forcing some people into situations where they feel like they might need to renew as is if they don't see the other options that are out there. And I think right now those other options are getting a lot more attention because people are saying, okay, well, if I've got to engage, I've got to find a way where a benefits admin platform can allow me to do so. And again, as Ed mentioned, as we do, the Health Pass platform is a nice way to be able to do that.
Yeah, and I think it's important that employers may be used to doing things the old way. And I still see that in our experience up till just recently, very few small employers were using technology to assist them, but I think it's because of a lack of awareness. And there's definitely, like such as Health Pass, there are tools and resources out there that can be accessed through your brokers, through your payroll companies, through your, through an exchange like HealthPass that can assist with not only providing benefits to your employees, but also with your day-to-day HR tasks that are necessary, whether it just be document storage or onboarding scenarios where you're storing I-9s and W-4s and things like that. And I think it's important that employers know that this is available to them, but not in this climate that we're in right now. We are certainly going into are in a more remote world. And I think that although some of the old way of doing business will come back, there is still going to be a very strong percentage of employees that are working remotely, in my opinion, after we're hopefully out of this pandemic in the near future. So I think now is the time. Like when we, in-house at Vanguard, we started to look at various ways. We took a deeper look at this stuff on how we could provide these kind of resources for our employees during this whole pandemic, because it was in the forefront. I think that's going to be more and more what employers are looking for, and it will be a very huge tool for them to assist. But I think the remote access of this type of information is important, because you're going to want to have your employees have access to their benefit information while they're at home, or through a mobile app, or through just their desktop computer. So I think that's important going forward. I just want to stop and see if anybody, I don't see anything in the chat, but does anybody have any questions they want to throw out at Vince while we're moving along right here?
All right.
You're so informative that
I must be.
That you've answered every question. So I do want to circle back to something, and I think I've gotten this question. I want to hear your opinion, because I've gotten this question several times. Again, going back to what we discussed about rate increases and the impact for the future, this is a very challenging time for businesses. So it can be frustrating. And one of the frustrating comments I've received a few times was, hey, I've noticed that the health insurance carriers had record profits in the second quarter, but yet my increase, even though it's increases that were imposed from last year right now, right? So if you renewed in September, you got a rate increase. And if you got your rate increase and it was 10 or 15%, you're probably, or most businesses or nonprofits are really not realizing that was set forth way before COVID-19 happened. So the frustration is there, right? So we see the insurance companies are recording record profits, but I am getting an increase on my health insurance again. So, I'd be interested for your perspective on that, and what, how you would, and if you're getting the same types of questions.
Look, cost is always the number one thing on people's minds when it comes to the insurance, right? How much is it? Why is it getting more expensive? It's the reality is it's a very expensive thing to have health insurance. At the end of the day, you've got organizations that are really trying to, first and foremost, most of these, United, the Aetna, the larger organizations are not-for-profits. They have shareholders, they have things that they have to do. So these are, they're not acting out of the goodness of their heart necessarily when they're doing things. They are community players, obviously, but they also have some responsibilities to other people as well that they have to hold up. All of that well and said, at the end of the day, those rates were figured on before this period of time. We do have almost that, as I was mentioning before, that fail-safe in place, which if something like this happens where you see that rates are going to be in excess of what needs to be paid back towards that, those claims numbers. And again, in that small group area in New York, we're talking about 82% of every dollar going back to the medical community to pay the doctor, the hospital, the claims on that. Generally speaking, just as an aside, because I know people think that the insurance carriers make money hand over fist, and in total they do, but it's very much a volume gain. They have very slim margins when you talk about this stuff. They're usually somewhere in the 3 to 5% profit margin, and that can vary widely depending on what's going on at any point in time. So, but that is, I always tell people, they're like, we have to get rid of the big bad insurance companies. And I keep telling them, I'm like, guys, it's 3 to 5% of the cost that you're paying out. I'm like, if I lower your rates 3 to 5% once, because that's it, they're gone, and then it stops. They're gone now. You don't get that savings any other time. If I do it one time, is it making your insurance more affordable now? So it's just not, I don't know, it's just not a realistic thing. But at the end of the day, I understand I have the same issue every time I get my renewal. I keep looking at it and saying, what's going on? From the consumer standpoint, I think the prior rate approval has been helpful to keep rate increases down. In 2013 in New York, they put prior rate approval into place. In 2014, when the ACA came around, there was a national standard of 80% for small group. New York was already 82%, so they were asking for more of that. And what New York routinely does is, quite frankly, take the asked for rates from the insurers, and it cuts them significantly. We've seen carriers ask for 20% and get cut down to 2%. There are times where this has worked well, to be completely transparent. It's worked well in certain instances in keeping them down. It's backfired in certain instances, because if it weren't for that, Health Republic back in the day would probably still be around, because the insurance department decided that they didn't want to give them a rate increase they needed in order to make sure that they continued to be solvent. And frankly, the backup money that was there from the federal government got defunded, and the combination of the two things together made it so that they just didn't have the solvency. So, it's a double-edged sword, but for consumers, the prior rate approval is something that can be helpful for the short term. What it does to the market long-term is the concern. Right now, it's been okay, but we have to be concerned about that too on the other side of the equation. So there's always that balancing act between the two sides that you have to be worried about. So, but let me just go back to, I understand the frustration. I get frustrated every time I have to think about getting my rates from carriers this time of year. I have that agita, because I know the next step is to take it and bring it out to the public and show you guys what you're going to have to do with that. And although I don't get to set them, you can be sure that people like to call me and complain about them. So Tommy's got his hand up.
Yeah, Vince, if I could ask you a quick question, because, listen, I understand what you're talking about, and it's certainly a struggle when we deliver these messages to our clients. I wonder, this is a much more global type view of things, from a wellness perspective, educationally, really as a society. And I've learned a lot of this from Ed over the years. Like, that's where potentially we can make an impact, is if we were a healthier bunch of folks that were looking to be insured. Mm-hmm. Can you speak a little bit about wellness generally, and maybe even some specific takeaways that business owners might be able to implement inside of their own groups?
So for me personally, we don't do a lot in the wellness area right now. We've looked at different things that we might be able to bring to our clients. I will say the biggest difficulty, and you guys are right? This is that's a population health kind of thing. Thinking about making sure that everybody is better so that it benefits everyone in that way. And we're in that situation with community rating, but what that unfortunately does, it takes the personal skin in the game out of the game.
Yeah.
When you're talking about a larger group and their rates are set, or somewhere else in the nation where their rates are set based on, how their experience realistically, how well or sick that they are, that can be something that, if a wellness program put in and structured the right way, it can help change habits, change behaviors, lead to lower claims. But there's, it's a difficult thing to try to do on the small group side, because at the end of the day, you normally don't really see the fruits of that labor in your premiums, whereas you see that directly on, in some other markets. So I think it's, I think wellness, though, I will say this, I think it makes all the sense in the world. And for us, it would be one of those things that we would like to try to have integrated more into what we do. But there are definitely some difficulties in doing so. And quite frankly, at the end of the day, it really comes down to costs, because we have a number of additional things above and beyond what you get with traditional health insurance. But all of those continue to cost more money. And so we want to keep it affordable, but give you the best value as possible. And you got to find that kind of, that juncture. So.
Yeah. Well, there's not, again, like to your point, there's not a whole incentive in small group really to do this, other than to create a stronger culture for people. And ultimately, if everybody did get healthier over a number of years, it would improve, I guess, the community rates at some point as well. I wonder, I'm sorry, I real quick, I'll throw this out there, and if you have
Yeah,
more
you
on
finish.
that thing too. Are there certain products that we can expect to come down the pike from Health Pass going forward? I mean, we're big fans as a firm of your product set, but I wonder if there are things that are some new attractive benefits that are on the horizon that maybe you can share with us.
So we're working right now towards bringing a couple of things on board. They're not done yet, but we are looking at doing like an HRA next to it. That's a possibility that's being worked on. We do have the SA and DCAP kind of thing that we're looking at as well. So those are two other products. And I would say right now, and then there's the parking and transit benefit that actually will come in conjunction. So those things are things that we're looking at. Beyond that, right now, we're trying to really make sure that anything else that we bring to the table is going to make a lot of sense. I do think one of the, I'll say it's the lower hanging fruit, but something that's more perfunctory thing that I think people have to do is require DBL. Bringing that in. We've tried to do that before. There's some things with the pricing that make it a little bit complicated to be able to do it, but we're working towards that as well. So there are, other pieces to the product that we're trying to bring. But I will say that more than anything, and again, everybody on this call, those are the things we love to hear about. What is it that would round out this portfolio that would be helpful to you? Because at the end of the day, what we want to try to do is take the burden of administering and accessing benefits off of the employer, make it so that they can make a decision on the front end to say, look, I want to offer Health Pass and all the benefits it gives. Here's the money I can give. They give people a defined contribution in our thing. So here's $500 for every single person towards the cost of benefits. It's not going to cover you probably for most of the plans, but it'll cover part of it. You can buy whichever plan up from that you want to, that makes sense. Or you can take it to use towards other benefits, because you can buy dental and vision and life and AD&D and LTD and all these other pieces. So that's what we're trying to find, is how do we do the things that as an employer too, or as an HR person, that we can kind of step in and just make your life easier. And the way we figure that out is from feedback from guys like you. So.
Yeah, and I'll just throw in there on the topic of wellness. I think it really relates well to something else you were talking about. But I think it's definitely, especially in small group, it's a more global approach, right? And I think that you're going to see more and more now that as a society, we are trying to get healthier. I think, and I think that COVID-19 could bring that even more to the forefront right now, right? It's been widely noted that people with underlying conditions were really hit hard with this, right? So I think that that's going to bring wellness to the forefront. I'll throw out there, the other day I saw United Healthcare. United Healthcare is implementing a wellness strategy for all their members now, not just large group members, not they're still large clients, they're small group clients as well, where they're going to provide on renewal, they're going to be providing a weight loss program. And I thought that was a very, very interesting statement by them, that they are investing in this population. And then so the days, yeah, I agree with what Vince and Tommy both mentioned, and the days where employers would just look at this and say, well, how is my wellness strategy going to impact my bill right now? And you could never answer that question, because it really didn't happen like that. If you're a large group and maybe you implement a telemedicine to keep some people out of the emergency room and you're self-insured, or even if you're not self-insured, you could see impact on your rates. But on a small group company, it's got to be more global. And I think that will help. And, I think it also just helps to prove that there is some science behind this. Rate increases are, and as Vince pointed out before, insurance companies are working on a small margin. And I don't mention that, and I don't think Vince mentioned it, because either of us work for an insurance company or really have any vested interest in any insurance company. We don't. But I think it's important for employers to understand that there is some science behind it. It's not just an arbitrary number that's being thrown out there every year when you get that 10% increase. And in fact, every year you probably get those letters in June that everybody, you know, because our phones start ringing every year in June, right? About, you know, I got a letter that my rates are going up by 20%. And really, that's just the filing with New York State, and they don't really come back with until October with the actual numbers. But it's important to note that there is some science behind this, that claims do factor into rate increases, and it's just not arbitrary. And wellness could make an impact long term. So with that, and I think in the spirit of wellness, what else, Vince, can employers or should they be looking to do that might help them offset increases, prepare for increases that might be coming down the pike? You know, I know you guys are very big into defined contribution, and maybe you can touch on that a little bit, but, you know, how is an employer going to be able to plan for expected increases and still keep his or her employees that are so valuable to them?
Yeah, no, I mean, I think, look, there's a lot in flux right now. Healthcare has remained somewhat of a constant, right? With the prior rate approvals, it's a little bit easier to know that you're probably not going to see a 25% rate increase in any given year. You know, you are to expect something at least in single digits. The double digits are a little fewer and further between these days, whereas they were the norm back before ACA and everything else. But you know, at the end of the day, it doesn't matter if even with predictability, it's so expensive. It's usually your big ticket item, right? You've got your salaries, your benefits, your space. Those are the things that are going to take up most of your working income. So, you know, what you need to do is really be thinking about how do you get creative around that? What can you do that's going to make sense to be able to bring a solution that makes sense? As Ed said, it's got to make sense for the employer and the employees, right? So, and that's kind of where we try to find that sweet spot with HealthPass all the time. So Ed had mentioned before, and the defined contribution, being able to use that as a baseline for really offering benefits. It's a great way for an employer to say, look, I have a commitment to my employees. I'd like to give them the best. I understand first and foremost, now things are different, right? 20 years ago, you'd pick one plan, everybody would get that same plan. Now, even with the one carrier, if you're getting plans, you're usually getting a high, low, or at least a couple of choices. This is the ultimate, right? This is where you get to say, hey, I'm an employer. Here's that $500 per person. You're given that, they're given as benefit bucks. Go online, log in. You have your own personal screen. You can go in, you can choose based off of that defined contribution, what medical plan you want, or you can waive your medical plan. Then you can pick from dental, from vision, and from all the other benefits and create your own benefit package, putting in as much money or as little money as you want to devote to it. And we're not going to make you pay because, you know, we're a 10-person organization or a 5-person organization and the head of the organization wants the high-end plan. Not everybody needs that. And we don't need to overspend for that as an organization to do that, right? Not everybody needs the PPO plan with a national network. Some people are very happy to have a very small, narrow network that is their local doctors and hospitals. That's where they're going. They're not going to some other far off place for this. They're going locally, and they can save a lot of money by having access to that. Whereas if you're only bringing one plan to the table, that might not be the case. So I think that works really well for us because the employer benefits because they get defined contribution. They figure out how much they're going to pay from year to year. They get to set that benefits budget, and then they pass it over to the employee to make the decisions about their healthcare. So they empower them. They say, if you're going to spend all this money, because it's more and more of a share they're paying every year, if you're going to spend it all, you might as well get to determine where it's being spent on, right? I mean, how insane is that about how much money people have to contribute towards healthcare sometimes and don't even get to choose what it is? They're just being told, this is the one you get. You have to pay for it now. So for something that's so expensive, it just seems not really the way we should be doing things. And there are options and opportunities to do it in a different way. So I don't know, Ed, what do you think? I mean, I said it before and I'll say it again. It's just trying to, you know, small employers have so many things that they have to deal with. They should be able to offload some of these people to partners and experts that they feel like they can trust. And so that's always what we're trying to do, is be that trusted partner and expert. And Ed, you're on mute, so I see you're about to talk, but I'm going to tell you that before you do.
Another thing that happens all the time in our new world. I agree with you 100%. And these are conversations we have with our clients all the time about choice drives down cost, in my opinion. I had this conversation 15 minutes before we had this call. You'll be happy to know, Vince, it was about your product. Choice does drive down cost. Not everybody needs the same level of healthcare and benefit as other people. And if we are making, from an employer perspective, if we're making global decisions about our entire population to try and please everybody in the spectrum, you're not going to have a lot of success in pleasing everybody. And you're probably not going to drive down costs at all. However, if you create a model that allows the younger and or healthier people to pick plans, as Vince said, that has narrower networks or higher deductibles, and then other plans that employees can buy up to pre-tax if they are going through some higher claims utilization, that drives down costs for an employer. And also, when employers start to define their level of contribution at a fixed dollar amount, and you provide choice, you can now make renewals a lot easier. So you're not in a situation where if the price is going up by 10% on one plan, everybody absorbs that, including the employer. Now it's a matter of, okay, let's talk to the employees that are utilizing these benefits and find out who's using what and help them make better decisions. So I think that it's an excellent point. I think that employers do need to have some choice in their offering to employees in order to offset that. And that's a great planning strategy for the future. We do have a couple of questions here. So let me throw one or two out at you. So here's an interesting question, and maybe you can give some feedback on. A question is being asked about if you're hearing anything more about association type benefits that will allow businesses to pool together. Now, you're not pooling benefits for employers. You're a multi-employer type plan, but are you hearing anything about association type benefits that might be available in the marketplace at some point?
Yeah, so there have been a lot of things that have been proposed over the years. There's the association health plan legislation. That is something that had some potential legs, but New York basically has made it so that that's not really an available access point. They've kind of shut down the ability for you to be able to go and to aggregate those people and to take them out of the small group market. And that's really what it's about. So, it's trying to get people who are in that small group pool and move them. So I don't know that, I'm not sure really where
I think that it's an interesting question, and it's one that before associations were brought up on a federal level, let's call it, people have been asking that for years. Association plans, were around 25 years ago, and they were one way that employers access those benefits. And as most of you know, that dissipated over the years for various reasons and legislation that made that difficult to provide. I think it always comes back to that question of, people, going back to what we talked about before, there's a true science to rating, and there is definitely a challenge with the pooling businesses together for the purposes of providing benefits, especially when you're talking about on a national level, right? Because the cost of a hospitalization in New York City is going to be far different than a cost of a hospitalization in Oklahoma City. And how are you going to pool that, and from a rating perspective, be able to provide something that is real and sustainable? I think that's just going to be a very difficult thing, and always will present a challenge.
And just like you said, and on the flip side, the state, as I said, kind of stood in because they don't want that happening, because they are worried about the profile of the risk in the small group community rated pool. There are ways that, people will always try to pull people out of that if they can, because healthier groups are going to, be able to run at a better rate than what the community rate is. And so I think New York State just in general looks for ways to kind of try to keep from having too much get pulled off the sides of that risk pool, because it just in the long run won't work for a community rated environment.
So another question is here, and I think it's on the same path. Do you or have you heard of anything on a federal level that would be imposed on insurance companies to keep premiums down for small businesses? You know, maybe as related to stimulus.
Yeah. So yeah, we haven't, not on a federal level. I know locally we had some premium extensions that were put in. At first it sounded like it might have been some premium relief, but it was more of a timing relief than it was an economic relief. But yeah, I have not heard from the new stimulus packages that they were talking about any talk of doing something to try and offset the costs of this, of what COVID might mean. And again, COVID meaning that it might hit not these rates, but the next rates, but the people need the relief now, because obviously this is when the pandemic is hitting. So the one part that at one point they were bantering about, and I don't know where it's landed because it's just been in stasis for so long, they were talking about doing a subsidy for COBRA. I believe that they wanted to, on the left-hand side of the aisle, they wanted to do 100% COBRA subsidy for a 3-month period or something longer than that. That would have, and frankly, on the right-hand side where you normally don't hear them talking about stuff like this, they said, no, that won't work. It can only be for, I think it was 92% of the premium, or 90%. They were talking about funding most of it as well. But I don't know if this was early on in this latest package. I don't know if during all the horse trading that's fallen out. So I haven't been able to see anything new about that. That would have been the one interesting thing where I think you would have seen direct relief, and it may have caused some weird marketplace kind of adaptations, because now there's an incentive for people to be put onto COBRA from your current plan. So, I don't know where that's going to go, but that was the one piece that I saw that might give some direct economic relief around healthcare. Beyond that, for small businesses, I really haven't seen anything.
Okay, and we have a question here from, and this is actually one of your clients, and their question is specifically related to Oscar. And Oscar did have, they seem to impose some significant rate increases this year, and are getting close to, the Oxford premiums. I mean, they're not there yet, I don't believe, but it's getting closer. Anything you can shed light on? It was a cause of that?
Yeah, it's difficult. New York, there are a lot of things that are in play that makes it difficult for some of the smaller insurers to be able to do things for longer periods of time. One of the things that happens is there's this, basically there's this risk adjustment stuff that happens in the background where there's a reimbursement based on each member in the plan gets basically a risk score. And if your plan is taking people with the worst risk scoring, then the plans that don't have that bad of a risk score have to wind up paying you behind the scenes because you took on that worst risk. A very good idea in kind of a general sense, but what happened was it makes it so that those who are attracting better risk, younger populations, are now disadvantaged, because not only are they having to pay for whatever might come through that, but on the back end, then they have to pay for the older populations that are hitting the other people's books. So it's a little bit difficult for them to navigate on a year-to-year basis. That's why I think with smaller insurers, sometimes you'll see bigger blips and smaller blips, sometimes bigger and sometimes smaller, whereas it's a little bit more steady maybe with some of the larger insurers. Oscar did ask for a 29% increase, I believe it was this year, so it was extensive. I believe that it came back to be a 9% from the state. So I know did actually, one of the things with their filing is that they were trying to account for the COVID claims in the next year's premiums. And I think that's why the number 29 was so high. So I think that might be even a little bit of a crystal ball into what might happen with 2022 rates, that there's, a significant portion of what was asked for in 2021 that probably isn't applicable until the next year. But yeah, in general, we're just waiting to see the finalization of what the portfolio and what the rates are going to be like.
All right, so we're just about 1 o'clock here. I want to put a bow on this, but so just one other, Vin, maybe you can just give, Vince, you can give us, your insight. What do you see, in your opinion, as the future of employer-sponsored benefits as a whole? I think we covered, a great deal in relation to that in this talk, but what is your viewpoint? I think a lot of people are asking about single payer, and if that's a real viable, or Medicare for all, which is probably more recognizable.
Yep.
What are you seeing as the future of employer-sponsored benefits?
So I, without getting too political, whether you're on,
Please.
I think both, put it this way. I don't think either candidate is going to be looking to push for a single payer or Medicare for all anytime soon. I do think COVID is a bit of a game changer. So whereas it was very clear that President Trump would not be interested in doing that or moving in that direction, that was part of the platforms available to those on the left-hand side of the aisle. And so with Biden winning the election, that was not actually something that he was looking to do. But there are a lot of constituents in that party that I think are looking at that as a viable way to go forward, especially those who had backed Bernie Sanders originally. And so there's going to be a lot of conversation around that, I think, on the left-hand side of the aisle, should there be a Democratic president elected this time, if Biden should win. Whereas I don't think it's in the planning for right now, it's something that could eventually happen, but I don't think it's something we're going to see for a number of years. And frankly, the biggest thing about it is the economics just don't seem to work very well right now. So until they can kind of get through that, not that that's ever really stopped government from making something work, but I think until they can get a little better handle on exactly how it would play out, what it would mean, how they would expand the Medicare, I do think that there's the possibility you will see an expansion.
Yeah, I got another question. Just thought of.
Okay, not a Medicare for all necessarily, but a Medicare for more. So you may see Medicare age change. You may see, I believe that was one of the things that Joe Biden had in his package, was thinking about lowering the Medicare age from 65 down to either 60 or 55. So there are some things that obviously we're going to want to look and monitor, but I actually think small groups not going to be heavily affected in the next couple of years on what's going on. I think it's going to be a lot of people trying to continue to tread water in what we're dealing with right now with these increases, and hoping that there's going to be another way of kind of bringing everybody to the table. And I mean, what you're talking about is part of the solution before with the wellness programs. Population health, people would actually take this seriously, and everybody would take a real personal responsibility in what's going on with them and how they're living their lives. I mean, that's going to be the one thing that's going to determine how we can make it a little bit easier and a little cheaper for everybody to have health insurance.
Yeah, and even some very evident and easy initiatives like that right now, like telehealth. If people would use more telehealth as their first line of defense, I think that when cost reduction strategies started to become to the forefront, people started with, all right, don't go to the emergency room, go to the urgent care, right? But now I even feel like the urgent care gets overutilized to a degree, right? So, it's very easy to run to that urgent care. And I think that and those can be costly as well. So, using small tools that go along with wellness programs like telehealth could be very instrumental in long-term rate increases or the impact of those increases. And I think it's important to note too, on the single payer discussion, this is also something that is not just on a federal level. It's something that's been talked about in New York State for many years, right? So to Vince's point, the cost of this is an enormous undertaking, and whether that we would get to that level or not, I think, to sum it up, Vince, I think you still feel that the employer-sponsored market is probably the way people are going to access their care for many years.
Yeah, I think for the time being, unless there are some large changes, you're going to continue to see this because it's the prevalent way it's been done. unless, you know, there's some, obviously some tax implications and advantages and things that are all wrapped up in this. And, you know, I don't think you're going to see people move away from it too much. There have been, though, I will say this, there have been movements with exchanges first and foremost in other areas of the country. Again, doesn't make sense in New York, but the individual coverage HRA idea, which is similar to what Health Pass does, which is you basically give people money to go buy individual coverage rather than you know, small group coverage. So the employer just kind of gets out of the decision-making process there as well. So I think you see that individuality in healthcare becoming more. Again, I think it always goes back to the idea that as more and more people are putting more and more money in, you're going to want to give them a little bit more of a say in what they get to do with that. So
yeah, you know, and I'm a little bit of a geek when it comes to this stuff, but I kind of read these things in these healthcare bills. So I actually took a look at Biden's plan, and his plan is not single payer on his website. It's more about increasing the availability for subsidies through the federal government and allowing that to extend to much more people to buy individual type plans. So, you know, that could, you know, even further that you know, that discussion about individual coverage HRAs. So I don't see any other questions listed. Let me just do a once over check. No, I think we're good. So I want to thank Vince for being our guest today. Vince, great job as always. I think you shed light on a myriad of topics today. I'm getting a lot of responses in the chat room that people felt that this was a lot of great information. So thank you once again for being here today. We will send out to everyone a copy. We've recorded this, so we'll send out to everyone a copy of this recording that you can reference back to at any time if you like. And we'll also, we'll copy Vince on that communication. So if you have any questions for Vince directly, you're more than welcome to reach out to him and ask him yourself. So thanks again to Vince. Thank you all. Good seeing everybody today.
Thank you, Vince.
thank you guys for
Good seeing you, Gito.
Appreciate it.
And like I said, we'll be back on September 30th for our next series. So thanks everybody.
Thanks again,
Great.
Ed.
Bye.
Thanks, guys. Take care. Have a great day.
Take care, Vince.